Good morning, Dr. Nazif. I'm Guru Baran. The title of my case study for clinical internship 2 is Melioidosis present with neck abscess. The reason I chose this title because melioidosis with neck abscess is quite rare. Okay, next we move to introduction and the study background for melioidosis. The aim of my case study is to determine that the clinical features of melioidosis are highly variable and the optimal treatment for melioidosis available till now. Melioidosis is a disease caused by the facultative intracellular gram-negative bacterium which is Burkholderia pseudomallei. They range from asymptomatic disease, localized skin ulcers or abscesses, and acute fulminant sepsis to chronic infection. Melioidosis is endemic in Southeast Asia and Australia, but being increasingly reported in other tropical regions of the world. The most significant risk factor for melioidosis are diabetes mellitus and also chronic renal disease. But however, diabetes is the main risk factor for melioidosis. Melioidosis are not only reported in man or human, they are also reported in many types of animals, including kangaroo, orangutan, and even crocodile. As I mentioned before, a study was done in the state of Johor, reporting that vast majority of the cases have identified risk factors, the most significant of which are diabetes mellitus and chronic renal disease. These infections spreads or transmitted by percutaneous inoculation, inhalation, or ingestion. This is the image of the lesions or ulcers caused by the bacteria Burkholderia pseudomallei. As you can see, there are primary skin melioidosis and secondary skin melioidosis. You can also notice that the lesions or ulcers can occur in any part of the body. My case study is based on a 54-year-old Chinese man from Perak, Malaysia, who was hospitalized with a 2-week history of neck swelling, which is progressively increasing in size, and he was also suffering with fever, cough and breathlessness from last 1 month. He was also a diabetes patient. Besides, when verbally asked, he was previously visited a farm of his friends about a month ago. Okay, next we will see his physical examination. He was suffering with fever, where his body temperature was 38.3 degrees Celsius. His blood pressure was also quite low, and his heart rate was 120 per minute. The most important thing is, he was having a huge erythematous fluctuant swelling at the left submandibular region measuring 7 to 6 cm, and on admission he was also subfebrile. Based on his laboratory tests, it was revealed that some of his hematological and biochemical parameters were deranged. His erythrocyte count was normal, however, his leukocyte count was very high, and also the percentage of neutrophil. His glucose level and also HbA1c level was also very high, indicating that he was having diabetes. And other than this, all other parameters for hematology and biochemical were not significantly different. And yeah, his urea level was also quite high. And based on computed tomography of neck, it will show that there's an abscess collection at right side of his neck, and blood culture and abscess fluid was sent for culture. He was initially diagnosed with other disease related to dental. On the next day after culture, bacterial colonies on blood agar were observed, and it was pinpoint in size, around 1 to 2 millimeter, white umbonate colonies, and on McConkey agar, the isolate was salmon pink. The colonies had the characteristics musty and the earthy odor of Burkholderia pseudomallei. However, the subculture on Francis media confirms the growth of Burkholderia pseudomallei, and it was sensitive to ceftazidime, imipenem, cotrimoxazole, and MIC, MOX, and clef acid. Later, intravenous ceftazidime was primarily chosen for antibiotic therapy. After commencement of the intravenous ceftazidime and the frequent dressing of the wound improved, and the swelling was also progressively decreasing, and he was also getting better. The patient was discharged from the ward after completing 2 weeks of intravenous ceftazidime, and later eradication therapy with oral doxycycline 200 mg daily was started. After 2 weeks, he returned to the hospital with no recurrence of abscesses. These are the colonies of Buccoderia pseudomale growing on blood agar, McConkey agar, and also chocolate agar. Buccoderia pseudomale on McConkey, it is a lactose fermenter which turns into salmon pink color, and it was also slowly oxidase positive. Gram stain appearance revealed was the typical safety pin appearance. This is Buccoderia pseudomale colonies growing on Francis media. The colonies will be in yellow in color, differentiating from Buccoderia cepacia, and also Buccoderia pseudomale lyses the media. Next, we'll move into discussion. Melioidosis is a disease of public health importance in Southeast Asia. It predominantly affects people who met contact with soil and water. The disease can affect a spectrum of organs, and its clinical manifestation can also range from localized abscess to acute pneumonia and fulminant septic melioidosis. Once infected, it may remain dormant and become active after months, years, or even decades when the host is immunocompromised by drugs or steroids, systemic disease like diabetes, and social deprivation like alcoholism, drug abuse, and occupational exposure. Melioidosis somehow have very little report affecting ENT, and in a study of analysis of a lot of cases related to neck abscesses, it shows that Klebsiella pneumonia was the most common pathogen among others. In our case, the patient's white blood cell count and neutrophil percentage was very high. This might be because of chronic infection or chronic inflammation. He was also having slightly higher production of urea, which means that he has a higher toxic production in his body. Ceftazidime is the main drug of choice in systemic melioidosis, and it was given 120 mg per day for 2 weeks, and it shows that this prevents further formation of abscesses. Furthermore, invention of Francis media can also make the diagnosis easier and cost saving without using a high cost machine like Vitex for detection. Mortality in melioidosis is actually less than 10% of total cases, where resources for rapid diagnosis, early implementation of antibiotics, and good intensive care facilities for managing severe sepsis are available. In conclusion, neck abscess in melioidosis is very rare, but also an important differential diagnosis in patients with risk factors like diabetes and chronic renal disease. The patient was also known to have traveled to a farm where he might be in contact with the soil or directly inhale the microorganism. And that's all for my case study. Thank you.